Hi, I'm Sarah Stewart. I'm a family nurse practitioner. I am also certified in advanced education by the Obesity Medicine Association. I have been sharing a little bit of information from my CGM journey. I've been wearing this since the end of May, and what prompted me reaching out to my provider about getting a Freestyle Libre ordered was that I had some labs drawn back in April, which were a bit shocking. My A1C was 5.6, which is reflective of an average blood sugar of about 114. 5.7% would be within like a pre-diabetic range up to 6.4%, and then 6.5% and greater would be a diagnosis of diabetes. So it was a bit shocking at that time. I also had a fasting insulin level checked, which is, I look at it, a fasting insulin as like a canary in the coal mine. So we check usually yearly an A1C on patients, and we also check usually a metabolic panel, which will capture like what a patient's fasting insulin, or I'm sorry, a fasting glucose is. Unfortunately, we're not routinely checking fasting insulin levels. It's not part of standard practice yet. But what the fasting insulin level will show us is like how hard is the body compensating to keep this blood sugar normal. And so what I'm finding on my patients is that they're producing these massive amounts of insulin trying to keep this blood sugar in check, right? So when we eat food, the elevated glucose will prompt an elevated rise in insulin, and I picture insulin as being like the key that unlocks the cell, so we're able to effectively use food for energy within the cell. And so I had this fasting insulin of 7, and I consider like 7 like my benchmark. Greater than 7 indicates resistance. Some providers use even lower than that as 5 or greater. And then some providers are a little more flexible and say like 10 or greater. So again, big eye-opening experience for me. I eat a mostly whole food diet, time-restricted eating within an 8-hour period, 2 meals, whole foods, no added sugars. And what I did was I started really focusing on increasing my level of physical activity. And so at least 3 or 4 days out of the week, I've been making sure that I'm doing some resistance training, high intensity interval training, and one 30 to 45 minute Pilates workout. So I had my labs rechecked last week, and I found out my fasting insulin level had decreased to 2 from 7, which is wonderful. I also had my lipids checked, and I was looking at my triglycerides and my HDL. So your triglycerides are reflective of diet or excess glucose. So if you have an elevated triglyceride level on your lipid panel, it is reflective of excess glucose that's being converted to triglycerides to be stored as fat, right? So for my patients, I love to see less than 100. Less than 70 is considered optimal. And our lab range considers, anything less than 150 to be normal. So definitely if your triglycerides are greater than 150, that's kind of like an indication to take a look at your diet, reduce the amount of refined carbohydrates, added sugars, processed foods, of course. And so my triglycerides were 50, wonderful. My HDL was 70. So HDL is reflective of level of physical activity, like how sedentary are you? And so my HDL level was 70, which is good. So we call HDL like your good cholesterol. So we want that to be as high as possible. And less than 40 is considered low, right? So when we look at triglyceride HDL ratios and we have low HDL, meaning very sedentary lifestyle, and so we can see that on our HDL level. High triglycerides, meaning like highly processed diet or high carb, high sugar, just excess calories, consuming excess. The liver cannot compensate. It's being converted to triglycerides and being stored. So when you have high triglycerides, low HDL, we look at like that ratio. And so optimal would be like a 1-to-1 ratio, meaning your triglycerides would be like 50, right? And your HDL will be 50. So mine actually is less than 1. So I'm seeing like all this information that looks really great, you know, like a picture of metabolic health, right? So, but again, my A1C was 5.6, and I've just been kind of scratching my head over it. You know, what am I missing? So kind of bounced some ideas off of colleagues. I've talked to some clinical pharmacists who specialize in like diabetes management. You know, I'm watching my CGM data, and so my estimated average glucose on LibreView, which is just the program that kind of looks at like all of your reports and your CGM data. So my daily average is at 105. So if we look at what that translates to for an A1C, right? Your A1C is your average blood sugar over 3 months. It kind of shows like how much sugar is stuck to the hemoglobin. And so 105 average glucose translates to a 5.3 A1C. So again, you know, why is this A1C 5.6 again? Why hasn't it budged at all? And my glucose management indicator, which is another calculation using CGM data, is actually showing even higher, 5.8%, which is considered a pre-diabetic range. So I have kind of this mismatch. I have, you know, this beautiful triglyceride HDL ratio. My fasting insulin's gone down. My daily average glucose, you know, is 105, which means that like my A1C should be around 5.3. But I'm having a glucose management indicator of 5.8 and my A1C is 5.6 again. So something that I had read up on is it's possible that my red blood cells are living longer than what is considered average, or that 120-day lifespan. So like, why do we check an A1C every 120 days or every 3 months? Because the average red blood cell lives for about 120 days. So when we do A1C, it's taking, you know, it's looking at the red blood cell and seeing like how much sugar is stuck to it. And so if I have red blood cells that are hanging out longer because I'm healthy or non-diabetic, maybe there's just more availability or more time for the glucose to stick to it. There's also a possibility, Cindy, there's also a possibility that due to stress at work that I am undergoing gluconeogenesis, which is a term for the liver and actually kidneys' ability to make glucose in the setting of elevated cortisol levels so we can deal with high stress situations. So, you know, it's great if you're fighting a bear, but if you are undergoing stress on a daily basis, or you're not sleeping well and you have these chronically elevated cortisol levels, it's making it so your skeletal muscle is not able to like uptake glucose as well. And you're making glucose out of different substrates than what you should be. So again, I would love some feedback on this. If anyone wants to talk it out with me or has any knowledge that I don't have access to, I'd love to hear what people think. I would love to, you know, not worry about it anymore and move on with my day, but I'm gonna keep on riding this roller coaster until I get some more clear answers on this. So yeah, reach out if you have questions or comments, or if you have anything that I haven't thought of already. All right, thanks, bye.